WWL-TV, the spirit of Louisiana. This is Louisiana's news leader, Channel 4's Eyewitness Morning News.
And here's an interesting fact on this Valentine's Day. 70% of men and 35% of women continue to be sexually active after they hit 70. And studies are showing that it dispels a number of myths about seniors and sex. Urologist Dr. Baum is joining us with more about some other misconceptions. And Dr. Baum, intimacy, as time goes on, a lot of times, and probably propagated mostly by younger people, that older people just don't have as much fun anymore.
Absolutely wrong. They're interested, desirous, and able to engage in intimacy even in their 70s, 80s, and 90s.
Has that always been the case, or is it more prevalent now that the baby boomer generation is getting older?
I think it's always been the case, but it's been kept undercover. I think now it is more socially acceptable for older people to talk about their intimacy, but I think it's always existed, and now it's more socially acceptable.
And you always have these guys who are older, like a Hugh Hefner or a Pablo Picasso. Pablo Picasso, I think, fathered a child when he was 92. You know, so it's just like people still do stuff.
Well, I'm not exactly sure that Pablo Picasso was the real genetic father of that child.
Well, he said he was.
He may have said he was, but at 92, the possibility of having a viable...
But it's not impossible, though, is it?
It is not impossible.
Okay, so maybe Pablo was correct. But what do you say about people who do think that the older they get, the less desire they may have?
I think they need to know that it's okay, it is healthy, it is permissible, society does allow it, and they should engage in intimacy. And intimacy doesn't always mean intercourse. It can mean hand-holding, it can mean hugging, it's touching. It is just being interactive with other people.
And obviously, as we get older, I mean, things do change physically on people. But does that necessarily mean it has to affect your sex life?
No, not at all. A man may have difficulty obtaining and maintaining an erection, but there are medications that are available for helping him. A woman may have vaginal dryness as she approaches and goes into menopause, but there are creams and solutions and estrogen supplements that can help her. So there are assistance that they can engage safely and comfortably and enjoyably, and they can enjoy it just as much as younger couples.
And now, are most of these changes physical or mental because you think maybe, or a combination?
It's really a combination. You know, society has kind of branded older people as pushing them off to the side, saying, you know, they don't probably enjoy that, they don't need to do that. But we have found that even in nursing homes where people are left alone, that they will find ways to,
really?
Yes, to engage in intimacy. So it's natural and it is normal and it is perfectly healthy for couples to do so. There's no restrictions. If a man can walk up 2 flights of stairs without shortness of breath or chest pain, he can safely engage in sexual intimacy.
And there were some statistics out recently where it said, surprisingly, that STDs, communicable diseases, were on the rise for the elderly set.
They have to be just as careful as a younger couple. They're no more restricted or they can get these sexually transmitted diseases and have to be very careful and have to be checked out and talk to their doctor, and if necessary, a man has to use a condom.
And so what is the single biggest myth about growing old and sexual relations?
The single biggest myth is that it's over, you know, when you reach middle age or a woman after menopause. That's a myth. The truth is that they should, can, and want to have sexual intimacy.
All right, any final thoughts?
Well, if a couple achieves sexual intimacy, they can have Valentine's Day every day.
There you go. All right, thank you very much.